Hi, I'm Dr. Teresa Yang, the author of Nothing But the Tooth, an insider's guide to dental health. Today, we're going to talk about fillings, or more specifically, why does the tooth hurt after the filling? The tooth wasn't bothering you before, whatsoever. You know oral care is important and you religiously visit the dentist twice a year to get your cleanings and your checkups. And you're surprised when the doctor tells you that you have a cavity, but you follow his recommendation and schedule an appointment right away because you don't want the cavity to get any bigger. And now you can't even chew on that side. After almost a week, you call the office and are told to come in. The doctor says, "Does the bite feel normal?" Honestly, you don't even know because it hurts when you put your teeth together. So he numbs you up again, twice in 2 weeks, puts that paper in and says, tap, 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 and he does his thing. And he repeats this. Then he concludes, "Your bite appears to be normal." And he's satisfied. But you know that once the anesthetic wears off, the tooth may and probably will still bother you. He stands up as if the problem has been solved and says, "Oh, just baby it and come back in a few weeks if it doesn't resolve." "You sure the filling's okay?" you ask tentatively. He reassures you that the filling is perfect. You're dumbfounded. Although you really like this dentist, somehow he has made you feel like it's your fault that the tooth is now bothering you. What the heck is going on? First, with any medical procedure, it's not unusual to have post-operative discomfort. When you get a flu shot, your arm may hurt the next day or two. With a more extensive procedure, like a knee replacement, it might require weeks, if not months, of physical therapy and healing. After the filling, you may experience some gum tenderness. Around the tooth, a clamp or a wedge may have been used to help with the procedure. This kind of discomfort is usually minor and will disappear within a day or two. Or you may have pain or tenderness at the actual injection site. Although it's rare, a condition known as trismus can develop either right away or within 5 days after the procedure. If you had multiple injections, that can increase the chances of trismus developing. Trismus is marked by pain and an inability to open your mouth as wide as you did before. Usually this resolves, and you can use warm, moist compresses in this area to help with the healing. If it persists, pain medication or muscle relaxants or even exercises to help open your jaw wider can help. In very isolated instances, you may have an allergic reaction to the filling materials that can result in itchiness or lesions around the gum area. Although with an allergic reaction, the tooth itself is probably not going to hurt. The reaction can be to silver amalgam fillings or white composite resin fillings. The mercury in the silver fillings is known to be toxic in very high concentrations, but a true allergy to the mercury is exceedingly rare. If it does turn out that you have an allergic reaction to the filling material, the solution would be to replace it with a different material. So far, I've talked mostly about gum discomfort or pain, but we go back to our original question. Why does the tooth hurt after the filling? The number one reason is the bite is too high. When I was a dental student doing one of my very first fillings, I thought I had done such a good job of reproducing the shape of the tooth. And that night, my patient called me in tears saying that her tooth was really hurting her. Well, the following day, I sanded off most of the filling, and within less than 24 hours, all her symptoms had disappeared. If you suspect that the bite is too high in your filling, don't wait a week to call the office. Get in right away and get this taken care of, and there should be no additional charge connected to this type of an adjustment. Reason number 2, the filling material irritates the tooth. The majority of fillings placed in the United States use a tooth-colored composite resin. The filling stays in place through a process called bonding, where chemicals are applied to the tooth to allow the filling to adhere. In earlier generations of the material, It was commonplace for the tooth to be very sensitive to temperature and biting after the filling was placed. Primarily, this was due to two reasons. One, the composite shrinks after it's put in, and so it pulls the edges of the tooth together, creating tension and causing the tooth to be sensitive. The second reason is the phosphoric acid that's used to treat the tooth to allow the composite to adhere. Our modern day composites have substantially improved and the sensitivity is greatly reduced. But it does occur, and when it does, it can take up to 6 weeks for the sensitivity to resolve. In isolated instances, sensitivity can even occur 6 months to a year until the tooth is symptom-free. Reason number 3, the cavity is large. When a cavity is large and close to the nerve or the pulp of the tooth, there's a good chance that the nerve can become inflamed, sometimes irreversibly. And no one wants to hear this, but the sensitivity can go on for months and months and months. If the sensitivity escalates to outright pain, especially if it's spontaneous or unprovoked, as in it wakes you up in the middle of the night, the tooth may require a root canal. In these instances, your dentist should warn you about this eventuality before the filling is even started. Reason number 4, galvanic response. What is that? Galvanic response is an electric shock-like feeling that occurs when different metals touch each other. This can occur when a silver amalgam filling is placed and it contacts a tooth with gold on it, such as a gold crown. Usually, the galvanic response dissipates over time, but it can easily be remedied by your dentist putting some silver nitrate on the tooth. So, what should you do? Maybe you don't even care what the reason is. You just know the tooth hurts and you want the sensitivity to go away. Unless there's an obvious reason, such as the filling is high or you're experiencing galvanic response, the best approach is to do nothing. Resist the temptation to have your dentist remove the filling and replace it with a new one, because that will only irritate the tooth further. Maybe you've lost confidence in this dentist and you seek a second opinion. Really carefully consider allowing the second dentist to do anything, because the new provider will want to try and jump in and fix the tooth to gain you as a patient. Almost always, the sensitivity will go away by itself, usually over the course of a few weeks to a couple months. In the meantime, baby it, as your dentist suggests. Eat soft foods, chew on the other side. If the tooth is sensitive to cold, either drink on the other side or drink through a straw. If you need to, take the occasional over-the-counter pain medication. However, if the sensitivity persists to the point where it's outright pain, especially unprovoked pain, the kind that wakes you up at night, the nerve is probably irreversibly damaged. Contact your dentist to have them examine it. Your tooth may need a root canal. If the sensitivity persists beyond 6 weeks or 2 months, again, contact your dentist and have them re-examine the tooth. At this point, you might be thinking, gee, shouldn't my dentist take an x-ray? It takes a minimum of 6 weeks from the date of the filling for any significant changes to show up on the x-ray. Prior to that, you're only getting unnecessary radiation, and it might represent your dentist's desire to try and do something to help. What's the last word? Despite the possibility of any post-operative sensitivity, if you have a cavity, follow your dentist's advice and get the filling done. The longer you wait, the bigger the cavity will be and the greater the likelihood that you will have sensitivity. Until next time, this is Dr. Teresa Yang, spreading the word of good oral health that leads to good overall health. Thank you.